Bismillahirrahmanirrahim. Respected Chair, distinguished national and international faculty, esteemed colleagues, honored guests, dear residents and students, Assalamu alaikum. It is indeed a privilege to join you today as Patron-in-Chief at this important conference dedicated to robotic surgery. I congratulate the Department of Surgery for organizing a meeting on a subject that represents one of the most significant advances in modern surgical practice. When I began my surgical training many years ago, a good surgeon was judged by the size of the incision, the confidence of the hands, and the ability to deal with difficult situations in the operating theatre. Then came laparoscopic surgery. I still remember how many experienced surgeons were skeptical and said, "This is just a passing trend." Yet today, laparoscopic surgery is routine, and it's difficult to imagine surgical practice without it. I had to face these challenges all along. History has a way of repeating itself. Today, robotic surgery evokes the same excitement and sometimes the same skepticism. But if there is one lesson surgery has taught us, it is the innovation that cannot be ignored. Surgeons who continue to learn are the ones who continue to lead. People often ask whether robots will replace surgeons. My answer is always the same: no. A robot has no judgment, no compassion, no responsibility. It is the surgeon who thinks, decides, and cares. The robot is simply another instrument, an extraordinarily sophisticated one in the surgeon's hands. What robotic surgery really gives us is greater precision. It allows us to work in spaces that were once extremely challenging. It provides a three-dimensional view and remarkable dexterity and steadier movements. Most importantly, if used appropriately, it helps us achieve what every surgeon wants: safe operations and better outcomes for our patients. But the future is even more exciting than the robot itself. Imagine combining robotics with artificial intelligence that can recognize anatomy in real time, alert the surgeon to critical structures, or assist with surgical planning based on thousands of previous cases. Imagine residents learning complex procedures in virtual reality before even operating on a patient. Imagine expert surgeons mentoring colleagues hundreds of miles away through advanced telecommunication. These are no longer scenes from science fiction. They are becoming a reality. Having spent my career in surgery, I have learned one important lesson. The instruments may change, but the principles never do. Gentle tissue handling, sound judgment, careful decision making, ethical practice, and compassion for our patients will always define a great surgeon, whether operating with a scalpel, a laparoscope, or a robotic console. To our young surgeons and trainees, I would like to say, remain curious. Never stop learning. The knowledge you acquire today may become outdated tomorrow, but the habit of learning will serve you throughout your careers. As an institution, Khyber Medical College must continue to embrace innovation while remaining committed to excellence, education, research, and patient care. Our responsibility is not only to train competent surgeons, but to prepare leaders who will shape the future of surgery in Pakistan. I once again congratulate the Department of Surgery for organizing this excellent conference. I hope today's discussions will inspire all of us to look ahead with optimism and confidence. Thank you very much. Pakistan Zindabad.